Madam Chair, ganito po ba sa bagong Pilipinas na yung health po natin and social services, yun yung kinakaltasan natin, yung paano natin
No, Madam Chair, hindi po totoo
that is an
yan.
interjection kasi facts po yung pinapresent, Madam Chair.
Yeah, Madam Chair, you can make a point of order if the figures being presented is not correct. Because this is a budget briefing. Hindi po pwede na meron tayong drama na pinapalabas natin na lahat ng programa ng kalusugan ay tinapyasan and making the administration look back where in fact it is not true.
Madam Chair,
Madam Chair,
order.
I move that the interpellation of the Honorable Manuel be stricken off the records. So move, Madam Chair.
1 minute.
Before I start, may I reserve or may I signify for the second round? Baka makalimutan ko po eh. May I know from the Department of Health, how does the DOH arrive at the allocations provided for each region? And what are the factors that were taken into consideration in determining these amounts? I asked this question, Mr. Secretary, kasi yung Region 4A, insofar as the regional allocation of the 2024 expenditure program is concerned, 2.98 billion lang ang nakukuha ng Region 4. In the other departments, nasa top 5 palagi ang Region 4A. May I know the reason why ganito na lang ang napunta sa Region 4A?
Madam Chair, Your Honor, we usually assess the receiving LGU whether they can fulfill the requirements, if the site is available, if the readiness of the place to build the health facility, if they are willing to commit with the healthcare workers after the facility is finished, and then there's also based on criteria on the poorest. We usually allocate the poorest and most needy localities first, and then prioritize over based on the class of the municipality.
In the previous years, Mr. Secretary, ano po yung position ng Region 4A?
Region 4A, according to my colleagues here, Madam Chair, Your Honor, is in the top 3 for the funding support. Region 4A gets a lot of support, I guess, based on the population.
That is precisely the question that I'm asking, Mr. Secretary. Bakit in the previous years, nasa top 5 siya, ngayon bigla siyang bumagsak? May I know the reasons why?
I will look into that, Your Honor.
Sa H5 kasi tayo nagbaba pero kahit category 4 ka, mataas pa rin yung funding. Huwag mo nang sasabihin yung category 4.
So we'll investigate and we'll submit to your office why it went down, Your Honor.
Thank you. May I go to the Philhealth Insurance Corporation?
Gawa ka naman ng report. Gawa ka ng report.
For 2022, what was your surplus insofar as your sources and uses of fund, gross of tax subsidy and conversions are concerned? What was your surplus in the year 2022?
Madam Chair, if I can allow our funds management sector head, Sir Renet Limsiaco, to address the question of Honorable Congressman Acop. If I can allow Sir Renet Limsiaco to answer the question, Madam
Yes.
Chair.
Sir Limsiaco,
Thank you, Madam Chair.
you're recognized.
Maraming salamat, Madam Chair, and magandang hapon po sa ating lahat. As to the surplus in the year 2022, we have 76.64 billion, Mr. Chair, as we have premium contribution of 207.2 billion and benefit payment of 130.56 billion, Mr. Chair. Madam Chair.
Okay na pala. Sige. Madam Chair, may I ask what was your total assets in 2022?
Madam Chair, Honorable Kong Akop, our total assets year 2022 amounting to 454.8 billion pesos, Madam Chair. 454.8 billion, Madam Chair.
For 2022, what was your net profit?
Madam Chair, our net profit, including the other gains due to changes in ICL or insurance contract liability amounting to 151.5. If we gonna get that other gains, Madam Chair, again, our net income before change in ICL is amounting to 79.0 billion, Madam Chair.
Now, with these statistics that you have you requested national government for subsidy?
Madam Chair, on the part of...
No, yes or no lang, sagot. Ang tanong ko po is, have
Yes,
you
sir.
requested for subsidy from national government? It's answerable by yes or no, para dire-diretso po tayo.
Sorry, Madam Chair. Yes po, we requested a subsidy from the national government, Madam Chair.
Tatanungin ko po kayo, sa inyong laking pera na kinikita, kailangan nyo pa ba ang subsidy from national government? Kasi ang gobyerno po natin, nahihirapan na nga na humahanap ng pondo eh. So, I am asking that question. Kailangan nyo po ba ang subsidy from national government when in fact, according to the statistics, kaya nyong mag-self-sustain eh?
Madam Chair, Honorable Kong Akop, thank you for your question. Sir, we need the subsidy because we are currently in the process of expanding our benefit packages, which we haven't done, which PhilHealth has not done po in the last 10 years. And
With your indulgence, in the last 10 years, hindi pa nyo na bago yung inyong benefit package. May I ask, how many times have you increased your salaries?
if I can allow, Madam Chair, if I can allow our COO to answer the question.
Sir Santos?
Madam Chairperson, Honorable Representative Akop, I do not have the exact data right now, but I can say that before 2021, November 2021, we implemented the CPCS based on the Executive Order 150 issued by the Office of the President, and this is based on the study conducted by the GCG.
Madam Chair, tinatanong ko lang po kung ilang beses na tumaas yung kanilang sweldo for the past 10 years. Kasi 10 years, sabi nila,
Please.
hindi nababago yung benefits na binibigay eh. So, I would like to ask, in the past 10 years, ilang beses na tumaas ang mga sweldo nila?
Okay, COO, please provide the
Madam
specific
Chair-
response.
Thank you, Madam Chairperson. Thank you, Honorable Representative Akop. I can say right now, Madam Chairperson, without the data, only once, Madam Chairperson, this 2021. Actually, Madam Chairperson, Honorable Representative Akop, we were really behind because before this implementation of EO 150, we were still under the SL salary, SL4. However, the national government was already in SL5, Madam Chairperson, Honorable Representative Akop. But we will provide the required data, Madam Chairperson, please.
Thank you. I will go to one issue insofar as the services of PhilHealth is concerned. With regards to the health packages the PhilHealth provide for admitted patients, what would be the average percentage that these packages cover on the total hospital bill?
Madam Chairperson, Honorable Representative Akop,
COO, please answer.
Madam Chairperson, we have this average value per claim, and we peg it at 10,000 pesos per claim. But as to how much per case rate, Madam Chairperson, we do not have at present the necessary data. But again, we will submit that data, Madam Chairperson. Honorable Representative Akop, please.
Thank you, Madam Chair. I will cite an example. In the case of pneumonia, PhilHealth charges different amounts based on the classification of the hospitals. Di po ba? Pag class A or B, 15,000 yung inyo pong sinisingil. And for lower class classification of hospitals, 10,000. Tama. And if you look at it, it requires the same management and it requires the same medicine. Now, bakit po ganun ang pagsingil po ninyo? Bakit may difference na 5,000? It depende sa klase ng hospital.
Madam Chair, if you can allow Doc Ish to answer the question, please.
Go ahead.
Yeah, thank you po.
Madam Chair, Congressman Ako.
Microphone, please. Sir Lim Siakop.
Hello. Okay. Madam Chair, Congressman Akop, we don't pay po our packages differently sa types of hospital. So kung ito po level 1 or level 2, level 3, yung pong pneumonia, ang difference ng pagbabayad natin is according to the disease. So, the disease po type. Kung ikaw ay yung moderate type of pneumonia, at ang package po natin, for example, in a moderate type of pneumonia is 15,000, yan po ay ibabayad natin kung ikaw man ay na-admit sa level 1, level 2, or level 3. Hindi po nag-iiba-iba ang package rates natin according to the levels of facilities.
Thank you, Madam Chair. There was a time when PhilHealth required that pneumonia cases be admitted for 96 hours. Di po ba? So, depende sa number of hours. Kasi, kung yung pasyente, i-discharge mo before 96 hours, merong return to hospital yung claim nila.
The general rule po is...
Hindi, sagutin mo muna ako. Hindi ko tinatanong kung ano yung general rule eh. Tama po ba yung sinasabi ko?
Wala po tayong on the number of hours except for the 24 hours po yung general rule for admission. Ngayon, kung pneumonia po kayo, kung ito man po ay na-admit kayo ng 3 days or 4 days, again, ang package rate po natin is dependent kung anong type ng klase ng pneumonia, kung moderate or severe type of pneumonia.
Okay.
May I also...
Good afternoon to the Race family. Anyway, before I proceed with some of my questions, let me state that this representation supports the position being raised by Congressman Palma an hour ago with regards to its PEP, that its PEP should be downloaded and implemented to the DPWH. Now, can I get the commitment of support from the good secretary with regards to the its PEP?
Yes, Madam Chair, we already committed, and we reiterate that for the infrastructure part, we will try to delegate all that is going to be accepted by the DPWH, Your Honor.
Thank you, Madam Chair. Thank you, Secretary. Second, Mr. Secretary, how much is your proposed MAIP budget for 2024? Yung proposed, not the NEP. Yung proposed.
The proposed was 26, no? Our proposed was 42 billion pesos. The one that was placed in the NEP was 26 26, 22. 22 only.
So it was slash.
This was slash, yes.
Previous year, 2023 budget was 32 billion.
32
Am I
billion.
correct?
Yes, Your Honor. Yes, Madam Chair.
Madam Chair, I would like to manifest that the budget for MAEP of being requested by the DOH will be restored as requested by the DOH to the DBM. Thank you, Madam Chair. Now, let me ask just, maybe this is just a parochial question, but maybe it is also happening in all other DOH hospitals. With regards to the private rooms or semi-private rooms in DOH run and managed hospitals. Now, ang problema kasi, Mr. Secretary, those indigent patients, no? Qualified indigent patients na nakapasok o pumapasok o being admitted in the semi-private rooms are not allowed to avail the MAIP. Is it the policy of the DOH?
We allow that the same way we have allowed indigent patients in private hospitals. We actually now allow, the program now allows.
When was that? When was that?
Arce Grande. Madam Chair, can we recognize Arce Grande?
Madam Chair, this year, Honorable Congressman, we shifted into the based on the needs, not based on the based on the needs of the patient, not on the room. It is not dependent on the room. So kung ang kailangan po ng pasyente ay ICU, we will cover. If dun sa private po, pag ang aming mga medical center chief naman po, Mr. Chair, Madam Chair, and Honorable Congressman, tinitignan nila yung kung walang availability at na-admit po sa private, we cover it po.
So, just this year?
Yes, Madam Chair, Honorable Congressman, because...
But you confirm that in previous years it is not happening. Those indigent patients admitted in the private rooms are not allowed to avail the MAIP.
In the previous years, Honorable Madam Chair and Mr. Congressman, noon naman po ay pinabayaran pa rin naman po based on the needs po, kaya we adopted it moving forward. Na-improve po, nalakalagay na lang po sa policy because we revised our guideline.
Madam Chair, I do not agree on the statement made by the DOH because for the past several years and even decade, that is happening in our regional hospital in Region 6, particularly Corazon Locsin, Montalbano Regional Hospital. Indigent patients that is admitted in private rooms are not allowed by Dr. Drilon, your head of hospital in Corazon Locsin. He never allows. And that's why, Madam Chair, I just like to point out, please, Mr. Secretary, remind all those heads of hospitals with regards to the new policy of the DOH, paki-remind lang sila kasi as of last month, doon sa amin po, wala pa rin yan. Pag indigent, wala nang bakante doon sa ibang rooms, papasok sa private rooms, hindi maka-avail ng MAIP na po. Kahit yung pondo namin, they cannot use and avail our funds because that is the policy of the DOH now. Please remind all those heads of hospitals. Can I get the commitment from the Secretary?
Yes, Madam Chair, Your Honor, we will inform the Director of Corazon Montalbano to actually follow the guidelines to allow utilization of MAIP even if the patient is in the private ward. We will write him directly.
Thank you, Mr. Secretary. Madam Chair, and next is indigent patients, critical and emergency cases that is admitted in the private hospitals during emergency cases, then this transferred to a DOH or public hospital. Again, they're not allowed to avail the MAIP. Is it also the policy of the DOH?
The policy is already allowed as long as the hospital has a memorandum of agreement with the regional office.
No. What I'm saying, Mr. Secretary, is the patient from the admitted because of emergency cases from a private hospital, then transfers to a public hospital, is it the policy of the DOH that they cannot also avail the MAIP?
There is no policy like that, Madam Chair, no, Your
Again,
Honor. So,
Again, Secretary, Mr. Secretary, please check your heads of hospital, because if this is happening in my region, in my city, this might also happening in other regions and cities and provinces. Kasi sa amin po, since the start of the MAIP program, hindi po pwede. The regional hospital or the Corazon Locsin Montelabano Regional Hospital never allows those indigent patients admitted in the private hospitals and transferred to public hospital. They never allow to avail the MAIP. Again, please check, because this is a very serious problems of the indigents in our province and our region. And siguro nangyayari din po ito doon sa ibang regions and provinces.
yes, Madam Chair, Your Honor, we will check.
Can you issue, Secretary, a memorandum or a circular?
Yes, we will
Just
issue
to
that.
remind them.
Madam Chair, we will issue a memorandum to the regional hospitals.
Can I get the commitment of the Secretary before the plenary?
Yes, we will issue that before the plenary.
Thank you.
Madam
Thank
Chair.
you, Madam Chair. Last na, Madam Chair, sa
last question,
Madam
sir.
Chair, baka makalimutan ko lang, please list my name for the second round. Now, PhilHealth, you mentioned a while ago that the net of the PhilHealth is 79 billion for 2022. Tama po ba?
Yes po, correct po.
Now, 79 billion plus you're asking for subsidy to the national government.
Yes po, correct po.
How much?
The subsidy we're asking for po is
Sa NEP 101.5 billion.
po, if I'll allow Sir Renet to answer the question.
Madam Chair, Honorable Congressman, the PhilHealth subsidy request for year 2024 is 101.5 billion, Mr. Chair. For 2024 po.
Microphone, please, Compadrano. Yeah.
The 2022, minention ako kasi yung...
Sir Manny, sir, please put off your microphone. Yeah, thank you.
For 2022 and 2023
Sir
subsidy.
PhilHealth, please respond.
Check ko lang ang record. Madam Chair, our funds for year 2022 letters.
Subsidy. I'm asking for the subsidy.
Subsidy po ay nasa 2022 ay 79.930 billion, Mr. Chair, and 2021 71.292 billion, Mr. Chair.
And now 2024 again, how much?
2024, Madam Chair, Honorable Congressman, for year 2024, ang ating request ay 101.580 billion ay sin tax and 21.1 billion ay galing po sa PCSO and PAGCOR Fund. Madam Chair, Honorable Congressman.
Madam Chair, with that huge amount, Madam Chair, ang tanong dito, bakit ang dami niyong backlog doon sa payments doon sa mga private hospitals?
Yeah, Compadrano, just to clarify, that's the request or that's the actual funding? Kasi kaninang sinabi niyo 79 billion. Now you're saying 101. Which is, that's the request or that's the actual subsidy you got? Please respond to Compadrano.
That 79 billion, Madam Chair, is the net profit of PhilHealth. And they're still asking for subsidy in the government, national government, every year. So
Yes.
that 101 is the actual net budget.
Yes, Madam Chair. Yes, Madam Chair, Kong.
Now, Madam Chair, that is why, with that huge amount of funds, bakit nadidelay yung payment natin?
PhilHealth, please respond.
Go ahead. You want to say something? Again, Honorable Chair, Honorable Kong Akop, no?
No, Kong Paduano.
Sorry, my apologies, sir.
Yeah, it's okay. Pogi naman si
My
Kong
apologies,
Akop.
sir. Yeah. My apologies, Kong Paduano.
Yeah, but it is accepted. Please proceed.
As I mentioned earlier, because you were saying, sir, there's a delay in payments, bakit ang bagal ng pagkabayad, no? So, what we're planning to do para mapabilis is I was asking earlier, if we can be given 90 days, we're going to implement this DCPM.
What is that DCPM?
It's called Debit Credit Payment Mechanism, wherein po we will advance 80% of the funds, tapos magre-reconcile na lang para mas mabilis po. So that way po, as I mentioned earlier, within 90 days po, maximum, halos lahat po yung outstanding na 27 billion, mababayaran na po.
So, as of August, you have a 27 billion outstanding.
Yes po, that's the total po. That's the grand total po.
Regarding the nurses. When COVID came, Madam Chair, I was governor of Misamis Oriental, and we hired a lot of nurses. May we know if where are those nurses right now, Madam Chair? DOH especially.
Can I also request for everybody to observe silence? Thank you very much.
Thank you, Madam Chair. Those are the nurses referred to by Madam Castro that are still deployed under and still employed as contractual and deployed to local government. So,
No, as I understood, Madam Chair, not all nurses were rehired. Some were let go by DOH, Madam Chair.
So, the answer given to me, Your Honor, Madam Chair, is that the salaries were increased so that the number technically decreased, so that some were let go. So that's the reason. So we raised the contract of service.
So,
rate.
Madam Chair, does that answer the question of Congresswoman Castro? Because if the salaries were increased, meaning some of the nurses, they laid off. So where are those nurses as of now, Madam Chair? Because we lack nurses in all of our hospitals. But just a follow-up to the questioning of Congresswoman Castro. Let me proceed now, Madam Chair, to my second topic. Just a gentle reminder, because during the party allocation, I was able to discuss to the good secretary the status of our Northeastern Misamis Oriental General Hospital, we call NMGH. This is the status now, Madam Chair. That's 400 million, the one on the screen. That's 400 million. It was through an act, Madam Chair, 11721, approved by Congress, Senate, signed by the President, the establishment of a Level 2 hospital to decongest Northern Mindanao Medical Center, that hopefully it will serve as a SIF for all patients that will go to the city of Cagayan de Oro. As of now, this is the status, Madam Chair. Next slide, there. That's 400 million worth, Madam Chair. Next slide, please. There. That's 400 million worth of funds from the DOH. And a gentle reminder that they committed, Madam Chair, during the consultation, that by October, they will operate it into an infirmary. Can we get the officially on record the commitment of the good secretary, if they can really operate it with that status, current status as of the moment, Madam Chair? Look at the pictures, Mr. Secretary.
Madam Chair.
Secretary.
Madam Chair, Your Honor, yes, we are confirming our commitment with our regional director. By October 31, we will start operations as an infirmary. And we also would like to appeal for the proposal to include the 40 million medical equipment, which was actually slashed and put to tier 2. So we hope that we can get the budget for 2024.
Madam Chair, I'm requesting budget and hoping in the committee hearing, we cannot bring this anymore to the plenary. hoping, Madam Chair, is not good enough. They must commit, Madam Chair, because I will not be able to anymore ask them during the plenary. I must get a commitment today, Madam Chair.
Secretary.
Madam Chair, we commit at least to make it operational as infirmary, the equipment needed
Okay.
to make it operational.
Madam Chair, I thank the good secretary for the commitment. Madam Chair, supposedly it was started in 2021. They spent 400 million. For phase 2, supposedly they will spend another 450 million. For phase 3, 80 million. For phase 4, 350. For phase 5, 500 million. The 400 million, that's the outcome, Madam Chair. And when I scanned through the budget of the Department of Health, Madam Chair, I could not see the continuation for the second phase of 450 million. May I ask, Madam Chair, why?
Secretary.
We will propose for 2025, Your Honor, because it was deleted. We actually put it, but the DBM actually put it on what's called Tier 2, so they didn't put it in part. And when we put the 400 on 2025, we will make sure it's a MICA, multi-year contract authority.
But
so that
Madam
we
Chair,
can
they
finish
will
the
be
hospital.
operating it already by next year. And meaning operational around 80% the completion of the first 400 million. So we wait again for another year for them to allocate funds. I don't think that's fair, Madam Chair. I really do not think that's fair to the people of the islands of Mindanao, Madam Chair. It's either I get a commitment, Madam Chair, or I will be forced. And I thank already Chairman Karaps for the second. Hopefully, I will not need it, Madam Chair.
Yes, Madam Chair, we will commit and look for funds to actually allocate equipment for 2024.
Madam Chair, hopefully, before plenary, I will already be able to talk to DOH. If they can visit the office, so I can get already how much they will be committing for the 2024 budget, Madam Chair. Would that be possible, Madam Chair, Mr. Secretary, sir?
Yes, Madam Chair, we will commit before plenary.
Madam Chair, no further questions. Thank you. Mayong buntag sa tanan.
Thank you, Honorable Emano. From the minority.
Yeah, Madam Chair, last, I would also discuss with them additional, they were able to supply us with the equipments needed for St. Paul Hospital. They promised us that they will give us the number that were listed. We were only delivered 6, so that hopefully will also be able to discuss in the office, Madam Chair. Will that be...
Honorable Secretary.
Yes, Your Honor.
Thank you, Madam Chair. Again, thank you from the bottom of our hearts, from the islands of Mindanao.
Thank you, Honorable Emano. Now we move to the minority with Honorable Representative Raoul Manuel.
Thank you, Madam Chair. I also go straight to my questions. Madam Chair, na lang, I'd like to ask the Secretary regarding the pandemic, which one is correct? Is it correct na wala na po yung pandemic or may pandemic pa rin pero hindi na siya considered na emergency? Is it the first or the second?
There's no more pandemic. The WHO has already declared that the pandemic is over. But the disease, COVID-19, continues to exist.
Madam Chair, ito naman regarding mental health. Since pandemic po kasi ay lumalala ang mental health crisis sa ating bansa, it has been there before pero lumala pa nga, especially among the youth. Madam Chair, ilang percent po ng budget natin sa DOH ay specifically para sa mental health?
We allocated 600 million pesos for mental health, for the mental health program. This doesn't include our support to the National Mental Hospital, which is another certain amount. And so our mental health total is about, for 2024, is 682,708,800. We have an appeal of about 1 billion to address the gaps. So it actually decreased. Our previous year, 2023, the current year, is 1.8 billion. So this decreased actually by almost 63%, Your Honor.
Yeah, Madam Chair, ang laki po nung magiging proposed cut sa ating mental health services. Aside from that, Madam Chair, how about yung programs po natin or plans para madagdagan po mapadami yung ating mental health care professionals tsaka psychiatrists? Kasi Madam Chair, compared sa suggestion ng World Health Organization na dapat 10 for every 100,000 Filipinos ang psychiatrist, sa atin po 0.41. Madam Chair, di man lang umabot ng isang buong tao. Tapos Madam Chair, for every 100,000 Filipinos, 3 lang yung ating mental health professionals. So paano po natin mapapadami yun?
Thank you, Your Honor, Madam Chair. Actually, our program for mental health includes more of a community-based than a facility-based. So we have other extenders other than the professionals. We also should probably include that the TRCs, the treatment and rehab centers, also are part of our mental health program because substance abuse is considered also part of the mental health campaign. So we are now creating in the TRCs a lot of community-based programs also. So rest assured to our honorable congressman that this is part of my 8-point agenda. It's number 6 in my 8-point agenda. Ginhawa ng isip at damdamin. And we will try our best to actually address the mental health problems of our country.
Yeah. Madam Chair, that's noted. Pero ang question ko pa specific dun sa personnel na aspect, paano po natin mapapadami talaga yung tao na kayang nag-spread out sa ating bansa to provide healthcare services?
So, Madam Chair, the total psychiatrists we have is 651 nationwide. Very low number. The WHO actually initiative is actually about 516 psychiatric nurses, about 0.5 per 100,000, and 133 psychologists or 0.1 per 100,000. So we do hope that we will coordinate with CHED for the representation to make sure that more students actually enter into the fields of professional fields of mental health. We have to address the lack of specialists and also in the level of primary care. So we will use other physicians actually also to include this. We're also creating with PhilHealth a program for mental health. I think that's one of the benefits that was mentioned that we will come out soon, and hopefully our mental health specialists and primary care providers can provide the needed gap, address the needed gap in mental health. So we will also train to address the gap immediately. Band-aid solution is to train current primary care physicians on psychological first aid and identification of these cases so that they can be referred to the proper professionals.
Okay. Madam Chair, sa kabuang budget ng DOH, ang nabanggit po kasi yung 600 million for mental health services, tapos NCMH. Para yung total po, ilang porsyento lang po yon ng DOH budget? Mental health compared to yung total budget, abot po ba siya ng 10% man lang?
Madam Chair, it's about only 1% because it's about last year it was 1.5 billion, now it's less than that. So it's a little less than 1% of the total health budget.
Yeah. Tapos Madam Chair, kahit idadagdag natin yung budget for NCMH, ang konti pa rin talaga. So if we are to consider mental health as a critical part of the overall health of people, tingin natin Madam Chair, ang ganitong share, hindi talaga siya makakasapat. Also, yung budget natin for NCMH, it's 2.2 billion. At yung Filipinos in need, Madam Chair, 3.6 million. Yun yung mga may at least one type of mental, neurological, or substance use conditions. That's equivalent to only around 611 pesos per Filipino in need, Madam Chair. So, tingnan natin injustice ito sa mga may mental health needs. Ito na lang, Madam Chair, kasi 5 months na after na isa publiko ang malapig pen na kalagayan ng NCMH. So ano na po yung mga naging hakbang so far ng DOH para may saayos natin yung state ng NCMH?
Madam Chair, Your Honor, we have many programs. Some are also innovative. We have the Lusog Isip website wherein because of the lack of psychologists, there is an app that is open to our youth so that they can actually go to this app and be able to address some of their mental health issues, and they can be triaged and referred to specific centers. So this is one of the more cutting-edge things we have tried to do. So this has been just launched a few months ago, the Lusug Isip app. It's an app on the phone, and the youth can actually, this was launched in Ateneo. We're also trying to get our TRCs to address community. So the outpatient part of our treatment and rehab centers are addressing, because they also have in-house psychologists. So to address the need, ito yung ginagawa. Pero tama kayo, Your Honor, talagang kailangan natin mag-increase ng mental health professionals. Maybe we also start with nurses specializing in psychiatric nursing.
Madam Chair, magkano yung capital outlay for NCMH for 2024?
Some mental health, walang capital outlay. Capital outlay? Let me check and then we will verify. I don't think capital outlay may be just equipment. I don't think our mental health has a new building or a facility that's going to be built.
Yeah. Then, Madam Chair, kayo natin tinatanong kasi na isa publiko na nga po na ang baho doon, sorry for the word, pero ang dugyot sa NCMH na kaysa po mag-improve yung state ng mga pasyente doon, hindi talaga yun conducive para mag-heal po sila.
Madam Chair, Your Honor, I was informed by our ASEC Gorgolon of HPEP that there's allocated for 2024 200 million for the National Center for Mental Health, both infrastructure and equipment, so for renovation and for additional equipment.
Yeah. Sana, Madam Chair, no, hanggat kaya pa ay madagdagan natin. Madam Chair, on another topic, kasi po may standing na MOA, signed in 2015, ang CHR, ang Human Rights Victims Claims Board, tsaka DOH, for non-monetary reparation sa mga naging biktima ng violations and abuses ng martial law. Pero so far, walang implementing guidelines. So, paano na po na-implement ng DOH yung kanyang parte doon sa ganitong mga compensation?
Alam niyo ba yun? Anyone knows that? Your Honor, Madam Chair, I will study this and we'll find out how we can help implement. If we are the ones who's supposed to implement the IRR, I will follow up and make sure we come up with the IRR. But we'll look at the law and then we will address the issue of our honorable representation.
Duly noted, Madam Chair. To confirm lang, may budget po ba for this sa 2024 so far?
We'll also look, Your Honor, Madam Chair, hanapan naman ng budget.
Okay, kasi so far, ibig sabihin, wala, Madam Chair.
Sa mental health program, pwede kung yan ay batas, then we can get it from the overall 600 million that we put in the mental health program.
No, Madam Chair, ito ay para sa mga human rights victims. So, ibig sabihin, it's a range of health services na dapat nating ma-provide sa kanila.
Yes, Madam Chair, Your Honor, pwede rin natin kunin yan sa medical assistance for indigent program. Basta specific yung kanilang request. If they are victims of martial law, then we can, and they have prescriptions or we can actually address that from existing programs, especially if there is a law that is already enabling it.
Yeah, Madam Chair, we will further coordinate with DOH on this matter and hopefully po yung guidelines as soon as time possible ay magawa. Madam Chair, ito naman cuts on various programs of DOH. Can DOH confirm? May aside po sa overall na 10 billion cut, may cut po sa National Nutrition Council.
Yes, yes, Your Honor, Madam Chair, there is a cut.
Meron. Sa National AIDS Council, may cut din po.
Pinak, yes, Your Honor.
Health Policy and Standards Development Program.
Yun, hindi ko alam. I will verify. There is also a cut, Your Honor.
Din. Health System Strengthening Program.
Please wind up with the questions.
Yes, Madam Chair.
I will have to check whether the health systems have a cut or not.
Yeah, kasi based po sa research po natin ay meron po. Pati sa prevention and control of both communicable and non-communicable diseases.
Yun, meron yun. Yes, there
May
is.
cut
Your
din.
Honor.
Cancer Control Program.
Yes, meron din. No,
May
Your
cut
Honor.
din. Epidemiology and Surveillance Program.
Yes, Your Honor, meron
Meron
din.
din. National Reference Laboratories.
Meron? Yes, meron din, Your Honor.
Di ba, Madam Chair? So yun na lang for me to end up, Madam Chair. Nakakalungkot po, no? Overall, may cut. Sa maraming mga kailangang programa, may cut. So, Madam Chair, ganito po ba sa bagong Pilipinas na yung health po natin and social services, yun yung kinakaltasan. Kaya, Madam Chair, I also echo the sentiment of other colleagues natin na hindi dapat ganito sa DOH. Dapat po ma-restore yung cut at kung kaya, taasan pa po. Yun lang, Madam Chair. Thank you.
Thank you.
Move to interject, Madam Chair.
Honorable Garin.
Madam Chair, pasensya na po, no? With due respect to Congressman Raoul Manuel, Madam Chair, tila hindi po ako sumasang-ayon.
Madam Chair, just a point of order.
Yeah.
Are we allowed to interject? Because I thought there is a policy in this committee
Yeah,
that
Madam
there
Chair,
will
if I
be no
may. Yeah, Madam Chair, but my point
Because,
is... No, Madam Chair,
let
if
me
I may.
speak first, please. Let me finish first. That was the policy of this committee that was approved during the first meeting of the committee. And, well, in fact, during the previous hearings, nandito ako. I am asking also to interject, but I am not allowed to interject as part of the minority. Now, why are we now allowed to interject, Madam Chair?
Point of order, Madam Chair. Yeah. I really don't want to make a point of order, but I would find it unfair on the part of the administration being wrongly accused na maraming mga programa sa kalusugan ang tinapyasan. Mr. Chair, the figures is not correct.
Madam Chair, point of order.
Madam Chair, I'm
Madam
having
Chair,
a
yung
point of
binabanggit
order.
po, hindi po siya isang point of order.
Yeah.
Order is about yung proceedings natin, yung paano natin
No, Madam
pinapagano.
Chair. Hindi po totoo
That is an
yan.
interjection kasi facts po yung pinapresent, Madam Chair.
Yeah, Madam Chair, you can make a point of order if the figures being presented is not correct. Because this is a budget briefing. Hindi po pwede na meron tayong drama na pinapalabas natin na lahat ng programa ng kalusugan ay tinapyasan and making the administration look back where in fact it is not true. We have to compare
Madam
net
Chair,
versus net.
Madam
So
Chair,
with that,
point
Madam
of
Chair,
order.
I move that the interpellation of the Honorable Manuel be stricken off the records. So move, Madam Chair.
1 minute suspension.
Madam Chair, have we resumed hearing? Muna?
Yes, we did.
Thank you.
Gusto ko lang
Let
mag-object.
me just clarify everything. Let me just clarify. According to the rules from the appropriations, it is correct that we cannot interject. So,
I had a point of order, Madam Chair.
let me just clarify that. Okay?
So no, Madam Chair, so no interjection
No
is allowed.
interjections.
Just a point of order.
Yeah. So I had a point of order, Madam Chair, and a pending motion.
Yes, Madam Chair, since my interpellation was referred to, then I would like to express that I object to the striking out of my interpellation since for several agencies po, that's how we as young people compare yung ating mga plano sa pagbabudget. Anong meron tayo ngayon at ano yung plano from Malacanang na budget. Kasi yun yung magiging baseline natin, Madam Chair, how we will assert for higher budget for services.
Madam Chair, may I explain my objection, my point of order? I raise it as a point of order kasi tila pinapalabas na tinapyasan lahat ng programa ng kalusugan. And that's very unfair to an administration who has been investing on health. Kung magdadagdag tayo ng pondo, dagdagan. That's why my point of order is that there was a misrepresentation of the facts given because comparison is net versus net. Kaya yung mga sagot kanina na tinapyasan lahat ng programa ng kalusugan, that is not factual. I therefore move earlier, Madam Speaker, that those statements be stricken off the record. Because that will make the administration look bad. And that will make us look bad na parang lahat ng programa sa kalusugan ay tinapyasan natin. That's unfair to the people who have been working for the budget of the Department of Health. So I had a motion, Madam Chair.
Madam Chair.
I object, Madam Chair, to that motion.
May I have the floor, Madam Chair?
Madam Chair. Madam Chair,
Sorry. We
may I
need
ask
to...
for clarification?
Yes, Honorable Plato.
Kasi kanina pa akong umaga rito Madam Chair. Kung ganito ang mangyayari, abutin na naman ako ng alas 11 mamayang gabi. Just like the DOTR. Now, let's settle the issue. Bakit nyo pinapayagan yung point of order?
We will be
Yes,
clarifying the
please
rules.
let me finish, Madam Chair. Because our rules state specifically kung ano yung point of order and when it is going to be raised. Di ba? Kasi ina-allow nyo eh. But if I read section 103 for House Rules, and I would like to quote, a point of order is a privileged question that raises a violation of the rules in relation to the matter under discussion on the floor. A motion to read any part of the rules is equivalent to a point of order and takes precedence over any other motion other than a motion to adjourn. Yun po ang rules natin. Dapat yun ang sundin natin.
Thank you for clarifying the rules. Actually, that is what we are going to clarify. The point of order will, as mentioned, only be on the ruling and violation of the rules. Parliamentary. So, and with that, and because there's a pending motion, Honorable Garin, will you?
Thank you, Madam Chair. After conferring with our good colleague, I actually withdraw my point of order with the assurance of the Chair that the data that were mentioned will be corrected. So the wrong data that will be mentioned will have to be stricken off the records.
Madam Chair, question of privilege. May I be allowed to speak?
Honorable Raoul Manuel.
Yes, Madam Chair. Madam Chair, I don't see the point na may mga ipapatanggal po tayong facts and data kasi, Madam Chair, wala pa kong isa-cite na data kung hindi ito yung proposal na nasa National Expenditure Program. Second, Madam Chair, it has been also a part of our scrutiny of the national budget na kinukumpara din talaga natin yung actual budget ngayon tsaka yung pinopropose po sa National Expenditure Program. There are many ways to compare naman talaga, GAA to GAA, NEP to NEP, pero hindi po nawawala doon, Madam Chair, yung GAA to NEP. Kasi, Madam Chair, doon natin makikita na kung ano yung pagkakaalam ngayon ng administrasyon sa national budget, ano yung dapat ayusin, ano yung dapat baguhin. Kaya, Madam Chair, ako po, Madam Chair, na-notice ko, di ba, sa OVP, parang nililimit natin yung discussion, sa OP, nilimit natin yung discussion. Pati ba naman DOH, Madam Chair? Sana po hindi tayo matakot sa facts at sa katotohanan, Madam Chair. At i-allow natin yung mga deliberations at ma-put on record iyon. Yun lang muna, Madam Chair.
Thank you, Honorable Manuel. Let me yield the chairmanship to Honorable Stella Kimbo.
Thank you. So, may minutes pa ba si... Okay. So, just to set the record clear, Mr. Secretary,
Yes, Madam Chair.
so moving forward, when we make comparison of numbers, we just have to make it clear what we are comparing, whether we're comparing net figures versus GAA figures. All right? So just to make, to minimize confusion. Yun lang po, Secretary, okay? Moving forward. And for the members of the House, if a point of order is to be raised, it has to be based on a violation of a rule. Yun lang po. Right? Okay. So with that,
Madam Chair,
yes.
just to clarify, with regards to the statement, last statement of Honorable Janet Garin, what is the ruling of the Chair? With regards to the striking out of all the data pertinent to the position of the Honorable Manuel, what's the ruling of the Chair? Thank you.
Madam Chair. Madam Chair.
Yeah. Let me make. Okay.
No, I'm just asking the Chair, what is the ruling of the Chair with regards to the statement, and that is not a motion of the Honorable Garin. What I'm saying is, what is the ruling of the Chair with regards to the statement that she's getting the commitment of the Chair?
Okay, let me make a ruling on this first. We first have to set on record alin dito sa data ang mali. Alright, so we are referring to the data on page 12. Mr. Secretary, so let's do a rundown. All the numbers here. So can you confirm that these numbers are correct? one by one.
Yes, Madam Chair. For the
PhilHealth?
DOH, for PhilHealth, the NEP for 2024 is 101.5 billion, and the NEP in 2023 was 100.2 billion. So it increased. For Heart Center, the NEP in 2024 is 1.8 billion. The NEP in 2023 was the same, 1.8 billion. For NKTI, it was 1.3 billion in 2023. For 2024, it's 1.2, so minimal decrease. For Philippine children, it's 1.2 billion. It increased to 1.4 billion for 2024. It increased, yes. And for Lung Center of the Philippines, it was 630 million in 2023 NEP. It's now 561, which is lower. For PITAC, it increased from 156 to 174. And for NNC, it decreased from 401 to 296. And for PINAC, it's almost the same, 43, yes, increased to 46 for AIDS.
Okay, so all of these data have been confirmed by the Secretary, so there is nothing to be stricken out. Okay, so ang kailangan na lang natin ipaliwanag sa mga nakikinig natin ng mga kababayan is ang pagko-compare po natin ng numero is NEP to NEP at GAA to GAA. Sa ngayon po, ang pinag-uusapan natin ay NEP pa lang po. So proposed numbers pa lang. Ang maaprubahan na number would be the GAA number, which will happen months from now. So yun po ang paliwanag. So that being clear, we can now move forward.